we were going into the Black community because they were the ones who were dying 3 times greater than other groups. I wanted them to know that we as Black doctors and healthcare professionals cared about their life. We've been here since April, we're still here, and that all builds trust.
Hello, everyone. I'm Charlotte Sutton, the health editor at the Philadelphia Inquirer, and I'm so pleased that you could join us today for a conversation with Dr. Ayla Stanford, the founder of the Black Doctors COVID-19 Consortium. If you would like to submit a question that I can pose to Dr. Stanford, please do so in the comments section, which you will see at the bottom of this page. If you're watching us on one of our social platforms, you'll need to go online to inquirer.com/healthreportlive in order to submit your questions. So with that, I'd like to introduce Dr. Stanford to the conversation.
Hello.
Hi, how are you doing?
I'm great, thank you.
Good. I think that a lot of our readers or viewers might mistakenly think that giving coronavirus vaccines is just a simple matter of jabbing arms. Yet you are coming to us live from the Leah Corus Center at Temple University. You have been there for 5 hours, I believe. You got there at 6 a.m.
Gosh, yes.
And tell us what you've been doing for the last 5 hours.
Okay, well, again, Charlotte, thank you. And thank you to the Inquirer for having me today. So I arrive about 6. At that time, there's about 60 to 100 people already here. I have my seniors and folks that require special assistance that I need to get in first and make sure they're safe and seated, hydrated, and things like that. Then the vaccine comes from the Office of Emergency Management, and it comes in these coolers, which have the temperature probes, so they're maintained at the appropriate temperature. And if they don't, they start to beep, and then you need to go to step B. Then, because we are doing Moderna and Johnson & Johnson, I am the location for all vaccine. And so we have to have a count that is accurate so we don't take out too much or too little and people are waiting. And then everything has to come out and go on a timer. And then we have a different team and a different entrance for Moderna. We have a different team and a different entrance for Johnson & Johnson. We also have our EMT personnel that are observing people that are, so they don't, if they have allergic reactions, or they may just have forgotten to take their medication this morning and they're hyperglycemic, hypoglycemic, or their blood pressure is very high. So all those things have happened this morning.
And then you've just got people who are terrified of needles and could just fall over on you at any moment.
Yes, and that does happen. I mean, it's been 13 months, 14 months for some of us that we've been living the pandemic and pandemic world, if you will. And finally, the hope is there, the light is brighter, and people have waited a really long time to get to this point to be able to receive a vaccine. And it's so much of that built up that even without seeing the needle, just receiving it, people literally pass out. So we're there for that too. And then,
thank goodness. Well, you just mentioned the 13, 14 months. Let's spin the clock back. Now, back then, of course, you've been a physician for years, but you were a pediatric and general surgeon based in Jenkintown, I believe.
That's correct.
Practicing at Abington Hospital.
Yes.
How on earth did you, of all people, start running a vaccine empire to reach the people of Philadelphia who need it most?
Well, one, I'm born and raised in Philly. So I was born at Einstein Hospital, Croydon Olney, educated in the Philadelphia public school system. And so even though I went away for school 18 years, my heart and my home is here in Philadelphia. So when I finished my training, I came home. But I was home like everybody else, sheltering in place, the folks who could, with my husband, my kids, in our pajamas all day, eating everything. That's what we were doing. And then the reports started coming out on CNN and the Tribune. Actually, I still remember April 3rd, put out an article that said African Americans were dying at a rate greater than any other group in Philadelphia. And it was almost like a flashback to medical school some 20 years prior. And I was like, just remember feeling helpless as a 20-year-old, like, I want to make people better. I want to save the world. And I know nothing. I can't do anything. And as I started to feel that, I said, well, wait a minute. This is different. This is 23 years later. And I do have a private practice. And I can get access to testing kits. And I have personal protective equipment because I'm a surgeon. And I have a whole group of colleagues, of doctors and nurses and healthcare personnel and non-clinical people that I felt we could do something to change those disparate rates of disease and death. And that's how it started back in March and into April of 2020.
Yeah. Well, I remember that well because our photojournalists and reporters at the Inquirer were following you around at a time when nobody knew how to get a test. And all of a sudden it's like, Dr. Stanford's at this church in Mount Airy, or you're here on Broad Street. And it was really a remarkable thing how you got your colleagues together so quickly to help people out. Well, let's talk about some of those disparities. There was a lot of talk initially about vaccine hesitancy in the Black community specifically, but I don't think that's what you found. Can you talk to us about what you're seeing there?
Absolutely. So back in October, Charlotte, and granted, we had already been testing people from April through the whole summer, through the fall into October. Remember, cold and flu plus COVID, deadly combination. And so we use that as an opportunity to get people vaccinated against influenza. And then also we introduced a survey. So for all the people coming for a test, we asked them about their attitudes and perceptions related to getting a COVID vaccine. So we had a view into the minds of a lot of folks that we knew later when a COVID vaccine was available, what they were thinking. And some of the things we learned was that people didn't have as high a distrust. A lot of people thought it was manufactured too soon. And so then you could educate them about, well, yes, it's manufactured physically prepared in months, but that it had been studied for a decade prior, you know? And when people said, well, I don't want to be a guinea pig, we could say, well, 40,000 people already got this vaccine in a phase 3 trial. And so you're not the first one getting it, right? And so we were able to educate where people did not have the knowledge on topics. And once we did that and we started vaccinating, people have not stopped coming. And not that at the time I could say I thought a COVID vaccine would be here in December, but certainly what we did in October with the flu vaccine while concurrently doing coronavirus testing definitely prepared us for the COVID vaccine administration today.
Okay. So medical experts like you and public health students like me are fully aware of the many reasons that the pandemic had such a huge impact on communities of color. But a lot of our viewers might not fully understand that. Could you talk a little bit about the factors that make certain communities more vulnerable?
Yeah. Well, there's a myriad of them. It's almost an entire history lesson, right? A lot of it depends on the social determinants of health, which some people may be familiar with, but it's where you live. It's how you're educated, the type or the amount of resources that may be in your school district or in your region, It's the educational level attained by your parents. It's the type of job that you have that may be blue collar, white collar, in the public, not in the public. And so some of the things that made African Americans and Latinx folks more susceptible is at a time when we were telling everyone, stay at home, work from home, shelter in place, be safe at home. And we were saying to folks, go buy a month's worth of groceries. Make sure you have toilet paper. Make sure you have big canisters of water and all of these things. Well, one, if you live in a dense apartment, if you will, or high rise, there's not enough room to store food and water for a month at a time. You don't have funds to do that. You may be living paycheck to paycheck, quite honestly. And you can't afford to stay home because how are you going to pay your rent? And, you know, a lot of people sort of talk about, well, isn't that true for Black and white or Latinx and Asian? And I think people forget this historical perspective. And that is back in the 1910s and 20s and 30s and 40s, where a lot of my white friends and colleagues, families, they were building legacy. They were leaving a foundation for their children and their grandchildren. And for many Black Americans, you still weren't able to go to school. You still weren't able to get certain jobs. If you were enlisted in the Army, you couldn't get a job to come home. And so that wealth and legacy building wasn't happening for African Americans. And that's where, you know, you talk about the social injustice and sexism and racism and all these things that existed. And I know people say, well, it's 2021, that was before, but that history and herstory up to this point is why we have many of the conditions. So in essence, in 1920, as some of my friends were building edifices and foundations, my grandparents were helping you build your legacy versus being able to build a legacy for ourselves.
Mm-hmm. And the other thing that I think a lot of people don't know is that there is rock solid empirical science showing that the experience of growing up in a racist culture raises your stress levels, which harms your physical health. This is absolutely not even debatable anymore.
It's not subjective. It's not your opinion. That's
right.
Correct. And decreases your life expectancy, reduces your ability to pause in conflict and have better conflict resolution skills. I mean, there's so many things, but you know, with COVID, those things existed. But what I found more than anything was access, right? Because even though people of older ages, our seniors and the elderly were more vulnerable, you were seeing 30-year-olds, 40-year-olds, 50-year-olds, African Americans that were hospitalized and were dying. And they weren't necessarily not healthy. It was just that by the time they got any supportive care, because there is no cure, right? Before they got any care, they were so far gone, there was nothing you could do. There was no amount of oxygen, no amount of steroids or a ventilator that was going to help them. Because again, the messaging then was, don't come to the hospital unless you're so sick that you can't stay home, right? And people didn't know. And so they worked until they couldn't work, spreading it. Because again, these are your face front employees, until they literally couldn't breathe and got to the hospitals and collapsed. So much of this was access and lack thereof. And you know, the majority of testing locations were in affluent white neighborhoods. I think Drexel printed that back, published that April 5th of 2020, when they put the hot spots in all the areas you could get a test. And none of the testing locations were in the locations where people were dying of the disease and the positivity rates were the highest.
So do you, looking forward, do you see any reason to hope that there will be permanent changes made? Because obviously, you know, as you've been saying, these conditions have gone on historically. Do you think that there's any reason to think that we have finally gotten the message through?
I am a eternal optimist, so I'm going to say yes.
Okay.
Certainly for my life, and you mentioned, I'm a pediatric surgeon, so I operate on newborn babies up through 18 and sometimes older. But my last surgery I performed was in January of 2021, this year. And I had to say to my chair of surgery, I can't do both anymore. I can't put all of my energy into vaccinating and testing the people of Philadelphia and also have the same focus when I'm in the OR with one patient. And so for me, it's definitely what is next, because think about it. We now have over 50,000 people that we've touched between testing and vaccination that we can break down into quartiles of 18 to 25, 25 to 34, 65 to 74 and older, that we can focus on conditions that are prevalent in their age groups, right? Mm-hmm. And so I see the next step for the Black Doctors COVID-19 Consortium to do health advocacy and preventive care and education. And so that's what I'm working on for the next, because this has been such a huge investment of time and energy and emotion and mental fortitude and everything, right, that it would be a waste, to your point, to not take what we've learned and build on it. And, every once in a while when I'm outside and I see all those folks out there, and even the people who sometimes feel lightheaded, and you check their blood pressure, it's 180 over 110. Wow. at a vaccination site. And you're like, man, I'd love to be able to reach back out to those folks and talk about ways to better manage their hypertension. So,
have you talked to people who essentially say, hey, this is the first time a doctor has touched me in ages?
Yeah, a lot. And in the beginning, especially with the testing, man, people came with a list. They wanted to talk to you about everything. We're like, well, we're just doing your COVID test. And it would be remiss to say, give your doctor a call, because most of them didn't have a primary care doctor. And at the time, you could only get a telehealth visit, which brings you to the digital divide issues, because if you didn't have, not just if you didn't have a phone or computer, but the right age, or it had to be a newer model for you to be able to download some of these programs. So it really just made all of the disparities worse. And so, yes, a lot of people said they hadn't, and we answered lots of questions. I mean, we're all licensed doctors, nurses, nurse practitioners, PAs that are here administering the vaccine. So we did answer. We did. We were people's docs a little bit. Yeah.
Well, tell me something about your team. How many healthcare professionals have joined in? Are they still doing their day jobs and then coming to you, or how does that work?
So we have lots. So we have the volunteer folks that are full-time at one of the hospitals in the area, or they have their own practice and they just want to spend a couple hours with us a week. We ask people to spend at least 2 shifts a week with us, because the training of the different areas it's an investment. And we don't want to do that for someone that's going to come once a month, every couple months. So we do ask people to do that. Then we have the folks that are full-time docs, full-time nurses, and they might work 3 12-hour shifts at the hospital, which makes them, full-time. And then they spend their other time with us. Then we have folks that used to work that schedule and quit, and now work with us full-time, and they're salaried employees. And then, of course, there's folks like myself and others that this is what I get up and do every day. And so it's purely and squarely where my focus is. So it's about, if you add everybody, it's 200 people, but folks who are salaried folks is closer to 80 to 100.
Okay. A reader here asks a good question, which is, have you been getting much help from city government?
Well, it's persnickety, that whole question. And it is because in essence, I'm a private entity. I'm not, I don't work for the city or work for the hospital. So we have to go through the contract process like everyone else, the request for fundings or the RFPs that come out. And it's just a weird situation. I think the Inquirer, you guys put out an article a couple weeks ago where you listed the number of vaccines that each hospital had done and the Black doctors had done in a list. And right now we're over 32,000. After today, it'll be 33,000 something. And we're like at the same levels as some of the hospitals, right? And so you would think that we are, but we have to wait till the request for funding is hopefully granted and we submit an amount and then we see how much we are granted. But right now we have no contract with the city. Granted, they deliver the vaccines and we administer them, but everything that's happening since we started vaccination January 16th and we continue to do testing is all on money that we've raised, that people have given us through GoFundMe, through my personal funds. There's no city funding for what we're doing.
Amazing. You mentioned the list of doses administered. The other part of that list is who is getting the doses. And the Black Doctors group has done an amazing job of reaching Black patients. Everybody else, not so much. What's the secret? How did you figure out how to do that?
Charlotte, it's so like everybody thinks I'm so enjoying this. This is like a walk down memory lane. Give me 2 seconds. I think someone called me. This is Dr. Stanford. Come in. So it's trust. It's trust. Everything is predicated on trust. How you get your patients to be more compliant in a hospital or an outpatient setting is they trust you. The experience when they come to see you for their annual visit or their 6-month visit is pleasant, that they want to come back, that they feel like you value them when you're sitting in their office, that you're genuinely listening to their concerns, that you actually sit down when you come into the room, right? Things that seem so small, but people remember how you made them feel. So again, rewind to April of 2020, no one asked us to come to the hardest hit areas. In fact, people kind of looked at us a little, with some skepticism, like, what are you doing here, kind of thing. And it was basically, we recognized that you're dying, that what you need to protect yourself, a test and contact tracing, you're not getting. So that's why we're here. So to your question, we were not new faces. So when we were at Deliverance Evangelistic Church and we were at Christian Stronghold and Enon and Salem and some of these churches, they had been seeing us once or twice, 3 times a month for a year. I mean, there were no church services happening at the church. So the constant was us, right? And so when people then came to get their vaccine, it was like, hey, you did my test, last week, or you did my test. And so it was a lot of familiar faces. And to that, when we then needed a location to vaccinate, we had been at the Leocours multiple times before. And Daryl Clark, I have to give him a shout out, City Council, very instrumental in us having this building to be here. And also all of the leadership at Temple University and Spectacor, Leocours. We had already been here testing multiple times, tested like 900 people over the Thanksgiving Day weekend going in because everyone needed and wanted a test. So we weren't a new entity, and people trusted us as well as the buildings and the leaders, just like the people. And so how it wasn't something that was automatic. We didn't assume because we were Black people were going to come to us. It was because they've been watching us for a year. And when warm weather came and the positivity rates dropped, a lot of places closed. In the winter months, when it was too cold and the weather was bad, a lot of places closed. We only closed twice. Once was a hurricane, Isaias, and the other was a nor'easter, right? Other than that, and it was a snowstorm and people still came out, right? Those are the only 2 times. And so when you have that track record and you earn the trust, that's why. And of course, people feel comfortable a lot of times with someone who looks like them, who has shared a common struggle, if you will, and common joy. And a lot of folks even today said, how come you guys aren't at the church? I wish you were at the church. That's where I wanted to get my second shot. And I said, I know, we're here. So it's really trust. Yeah. That's the short answer. The one word answer is trust. That's how.
And the other part of it, though, I think goes back to what we were talking about with the digital divide. Tell us why you decided to go to the walk-up model rather than the computer registration model.
Absolutely. So again, it's everything people were thinking about. Everyone said Black and Latino folks don't want the vaccine because of atrocities of the past. There's, no one wants it. And so we put a link out the Monday before. I didn't even know we were going to be able to start vaccinating 6 days later, but we put it out on the Monday asking key questions. And in 24 hours, 1,000 people signed up. By Friday, it was 6,000. And by the time we shut it down, it was over 50. Wow. The reason we stopped, so that let us know. And then when I went to the city and said, we're ready now. And they, asked, well, how do you know? I said, well, I've got a couple thousand people signed up, 90% of whom are African-American. And so that was also a way to help us get the vaccine sooner, to show there was a need. Why we shut it down, we started it January 11th, and by February 10th, we shut it down. We shut it down because in the beginning, over 90-something% African-American. And literally 2 weeks, it changed to 50% African-American. It's like, what happened? And I realized, because a lot of the churches and folks were calling the office and saying, we don't know how to register, or I tried to register, but the time it took me to do it, it used all my data on my phone. So I couldn't use my phone for the rest of the month, right? So then we started dropping off boxes of paper forms at the church so people could come and pick them up. We tried that for a while. That didn't work so well. And then we even had appointments. But what happened is, and I realized some of this is a cultural norm, is that people expect if you show up early, you're going to be seen early. So we didn't start till 10, but people were here at 6 a.m. And you weren't going to tell Ms. Johnson, I know you have an appointment at 1 and you've already been here 4 hours. We're not going to see you till 1. They wanted to be seen at 10 when we started, right? They'd already been there 4 hours. And so you were always behind. And then what we also saw was that people obviously didn't have phones. They didn't have computers. And then we tried to do it with the telephone, but it takes an inordinate amount of time. You're getting a busy signal all the time. The phone, is crashing. And then we're just like, listen, we're going to make it public. We're going to let people know it's from this time to this time at this location. And that was fair. And as long as you met criteria, it didn't matter if you were rich, if you were poor, Black, white, yellow, brown, if you met criteria, you had a fair shot that day to get a vaccine. And that's what we were seeking, is equity, period. But when you're in North Philly, and anybody who's from Philly, the different parts of the city. When you're in the heart of North Philly and you're seeing Teslas and Range Rovers and Mercedes, I was like, what in the heck? And it was a very subtle kind of change, because even on the Vaccine Advisory Committee, which we served, we had talked about asking people for criteria and being very strict about checking eligibility, and decided that we were not going to police that, and people were just going to be honest and they were going to come out and whichever. And that did not happen at all. So that's why it's walk up. That's why it's not computer. Those are the reasons.
And at least we published this in the newspaper, that there are specific zip codes
Yes.
And are people following that, or are people still trying to pretend they're from a place they're not?
So trying, but not being successful at it as much as before. I have to say, when we started that, again, February 10th, with the zip codes, a lot of folks took to Twitter and took to opinions and talked about how it was reverse racism and discrimination, and who are these Black doctors, and who do they think they are, and where's the white doctors COVID-19 Consortium, and I mean all this stuff. And it was tough. I had to turn off my phone for a while because it was tough, because when we were testing, Charlotte, no one could have cared less. If they needed a test on a weekend and they knew they were open, folks would come find us. But other than that, we were taking care of underserved that folks usually leave behind. No one cared about what we were doing. We were testing, minding our business. Now we have the vaccine, and all of a sudden people are curious. Now they're learning about who we are and what we're doing. So the zip codes came about because, and they're all posted on phila.gov, it lets you know where the positivity rates have been the highest over the course of disease, and also ultimately where the transmissibility is high. And those were often the communities where people are working, where they're living in dense populous settings, and where they also have multi-generational households. Forgive me.
It's quite all right. Just so our viewers know, Dr. Stanford, while she talks to us, is running a clinic for thousands of people at the Leah Corus Center. And when somebody has an emergency, she's the one they go to. So, of course, her patients take priority over our discussion. So every now and then, if she has to jump away and get on the radio or consult with another physician, that's what's going on. This is a live broadcast, as we like to say. We are getting a nice outpouring on our social media of
people. I'm back.
Oh, good. I was just saying we're getting a lovely outpouring on our social media of people thanking you for your service. So it's horrible that you were getting the sort of nastiness that we were just talking about, but a lot of people are really, really appreciating what you're doing. So that is absolutely awesome. In fact, I've got another viewer here who wants to know, could you branch out? Could you do some vaccine events in other counties, especially Delaware County, which also has seen very significant health disparities?
Yes. So yes is the short answer, but with everything, you need personnel, you need the people, and you need vaccine. And right now, we are limited with Philadelphia residents and Philadelphia vaccine, which I know we're going to get to a point, I think that that's going to change, because with the flu vaccine, there was an exchange. And so we could do the flu vaccine in Montgomery County. Philadelphia residents could come. We could administer the flu vaccine in Philly, and Montgomery County residents could come. So we're not there yet, but we can. Montgomery County, we have been to Montgomery County, but the vaccine was not from the county. It was actually from Abington Jefferson Hospital, where I'm on staff, that they had Pfizer and wanted to reach communities of color. And so they asked us to get involved to help them administer it. Excuse me.
It's quite all right. I'm also seeing that people are looking for opportunities to help volunteer. So we'll see if there's anything there. I know, oh, there you are.
Yes.
People are asking, are there opportunities for healthcare providers who want to volunteer with your group? And I will ask at the same time, because I know there's always need for this. How can people contribute money to the Black Doctors Coalition?
So on our website, the www.blackdoctorsconsortium.com, there is definitely a link to volunteer or careers. We have clinical and non-clinical positions. We need everyone to be licensed in whatever your field might be. And I know other people do students and things like that. But it's too much going on, and I just need to know that folks are licensed. They've been doing it for a while and they're comfortable. And so that's our model. It's licensed healthcare professionals. And then and then donations. So some people mail checks to our office, which is on our website, but it's 419 Johnson Street, Jenkintown, 19046. And it is deductible. We're a 501c3. And other folks use the GoFundMe, but they have that fee on there. So thank you, though. Okay. Thank you.
Sure. Another good question, I know because I saw you setting this up this morning. What are you all doing to try to reach seniors who have mobility issues or are homebound for other reasons?
So we started Home Vax, and the email address for that is homevax, VAX, at blackdoctorsconsortium.com. Okay. And as you can imagine, we are flooded, but we're just taking them one at a time as they come in. Basically, a team of 2 people, or really one vaccinator and one person that helps set up, can do about 8 to 10 vaccinations per day, because you have to incorporate the vital signs and doing your vaccine and the observation period and all of that. So it really takes a small army to do it, but we have started. And our phone number, I'm pretty sure it's 484-270-6200, but that's also on our website. And someone said, can you post the number? Which it's there, but if you know of someone, you can certainly email on their behalf. Okay. So yeah. And right now I'm doing primarily Johnson & Johnson, because it allows us to get to more people as opposed to planning second visits with Moderna.
Can you talk a little bit about the different vaccines and how you decide who gets what?
So right now, the approved vaccines are, of course, Pfizer, Moderna, and Johnson & Johnson. The Pfizer and Moderna, we are not administering Pfizer, primarily because it's harder to use in the community because of the minus 70 temperatures and things like that. But the Pfizer and Moderna are both messenger RNA, basically, which it triggers a protein to mount an immune response, which are the antibodies that have memory, that if and when you're exposed to coronavirus, that your body will fight it off. So that's what the mRNA. The Pfizer is 16 and up. The Moderna is 18 and up. Pfizer is you get your first shot and second shot 3 weeks later, 21 days. Moderna is 18 and up. You get your second shot at 28 days. There is a grace period of about 4 days, however. So for example, if you were day 24 or 25, you could get your shot early. We rather people wait till the 28 days because there's no such thing as too late, right? But there is coming too early. And then with the Johnson & Johnson, the protein is actually encased in an adenovirus, which is a killed adenovirus, meaning it can't cause disease, but it's more used as a vehicle to get the protein to generate this antibody response. So with the Johnson & Johnson, your full immunity is conferred at 28 days or 4 weeks. So just because you get the shot today doesn't mean you have immunity today. It really takes 4 weeks for you to get there. What we've seen here is that people definitely have more pain at their arm site when they get the Johnson & Johnson initially. From my anecdotal observation, the Johnson & Johnson is more viscous or more thick. It's almost more oily than the Moderna. And I think that that's the reason why people have more pain in their arm initially. And there are some sort of side effects, if you will, with all three: sore arm, achiness, sometimes a fever, sometimes a queasy stomach or nauseous, even dizziness. But all of it subsides in 48 hours. And if you experience that, know that that's your body working to make an antibody or an immune response for you.
But on the other hand, if you are fortunate and don't have a lot of side effects, that doesn't mean that you got something.
That is correct. It doesn't
Okay.
mean. That's absolutely right. Thanks for saying that. Yeah.
Sure. We are getting some really, really great questions here. A person here is asking, a woman is asking, she says she's so worried about medical professionals and paraprofessionals who are reluctant to get vaccinated. They're on the front lines and they see the dangers. Where does this reluctance come from? And I would add, what do you do about it?
Well, I can tell you one thing I did. Abington Jefferson reached out to me because a lot of the employees at the hospital were refusing to take the vaccine. I mean, even like the coroners and people working in the cafeteria that were in face with the public. And I went to the hospital. We were going to do it as a Zoom. And I said, no, we need to speak candidly. Like, people need to be able to express their fears, their concerns, get questions answered. And that's what I did. And I think it takes a lot of those sessions where you just listen and see the why. There are going to be some people that just say, I don't know why I don't want it. I just don't want it, and those are tougher, but it just, you have to be deliberate about it. And it's not just one single conversation, it's multiple conversations. And then you allow people to make their choice. And if they're fully educated and versed and they choose not, I mean, that's their choice. Our goal is to get to 75 to 80%, though, for herd immunity, which benefits everyone, even the ones that did not take the vaccine. So one is talking to people in the hospital. I heard a lot of hospital employees say to me at different institutions that some of them felt, because in the midst of the pandemic, like, they didn't always have masks. They didn't always have the supplies that they needed. And they felt like they couldn't get a test when they needed to get a test. Some of them felt like they had to go to work, even though they probably had COVID because they weren't that sick, quote unquote. Someone said they weren't that sick. And I feel like they felt like, why should we trust you now? And that's an internal thing that has to happen in the hospitals and so forth. And it may take an outside person to come in and educate in a culturally competent way about it, because people are in essence saying, I know that this could save my life, but I'm not going to take it. And I mean, you got to dig deep with something like that, especially when 66% of the healthcare workers who have died are of color. 66%. So.
Oh, yeah. Amazing. Oh, I have to point this out. One of our viewers said that he trusted you with his son's life when you did surgery on him. And he says, Dr. Stanford is amazing. I had to throw that out there. That is always worth note. So we are getting close to the end of our time here, but I have to ask, one of these days, very soon, everybody's going to be vaccinated who wants to be vaccinated. Yeah. Mm-hmm. What do you do next? Do you go on vacation, or do you, what's next for you?
Me personally? Oh, yeah. Gosh. I don't know. Well, from a healthcare realm, definitely health advocacy, I believe, is the next path of my medical professional career. I knew I was always passionate about it, but never had a platform like this. That who knew that over 24 years of being a doctor, that I would have in my armamentarium what was needed to initiate. And now that we have a database of over 50,000 people, the majority of whom are of color, I would be remiss to miss an opportunity to do preventative education, to give people, quality, again, I'm saying culturally competent care in their communities. So even though I'm a surgeon and I'm still going to see children and operate for pediatric surgery, I feel like I want to be in the communities doing that with my urology colleagues and those who are breast surgeons and those who are GI specialists. So we can get to colon cancer, breast cancer, prostate cancer, and things like that that are so prevalent in our communities that reduce the life expectancy. So that's what I see next. But in the short term, getting together with some vaccinated family and friends for a Memorial Day barbecue. That's what I'm looking forward to.
Yeah. That sounds fabulous. Well, I know you have so much to do and you've been so generous with your time. I hope that maybe in a couple months or so you can come back and we can carry on the conversation, because obviously we have a lot to talk about. So anyway, thank you so much. I will let you get back to vaccinating Philadelphia.
Thank you, Charlotte Sutton. Okay. Bye, Philly.
Bye-bye.
We're here till 8.
Yes, everybody. Good point.
Yes. So we're at the Leah Core Center. It's 1B. So those are folks that are either 1B by your health condition or 1B by your occupation, which means you're exposed to, has the potential for high COVID exposure, or if you're just 65 and up, period. You could be 65 and up and healthy and live in Philly. And so, and the hard hit zip codes are the same as the city has posted. There's about 22 to 24 zips on there. For our seniors or folks that require special assistance, we get you in right away. The weather is great. It's windy and cloudy, but it's 70 degrees. So I would take advantage, and we are here until 8 p.m. tonight.
Okay, great. And remember, everybody, this is for Philadelphia residents who live in the zip codes that have been most impacted by the pandemic. So again, thank you. So, oh my, you are getting ready to work here. Okay.
Yep.
Thank you so much.
You're welcome.
Okay.
Okay. Bye.
Bye-bye.